Kind of ready. All right, everybody have the handout. Going to be working off of this, so this keeps us on track so we don't talk all night. So, anybody in here consider themselves pain-free? Raise your hand. All right, this guy's rolling on a phone recorder. Probably not. Okay, pain's not normal. You're not supposed to be in pain. Anybody think they're supposed to be in pain? What's the number one reason people think they're supposed to be in pain? Yeah, okay, we're not going to count on any trainers here. What? Because they are. Typically say, well, I'm getting older, I'm supposed to be in pain, right? So that's not true. So nobody said they were pain-free here. So it's pretty common, but it's not supposed to happen. So what our job is as physical therapists is mostly people come to us when they have pain. And we're trying to get people out of pain. That's part of it. Actually, that part's kind of easy. It's the education around why you had pain in the first place and how you can prevent this moving forward. So my name is Travis Robbins. I'm the owner of Robbins Rehabilitation West. I've been doing this for over 20 years. Dakota's been doing this for much less than me. But he's one of our PTs in our Bethlehem office. We do a lot of community education because, one, we like to do it, and two, it's really important for people to understand how the body works. Unless you want to go and get your doctorate degree in physical therapy, which is really long and expensive, you don't have to do that. You can just listen to us. And by the end of tonight, so in like the next 30 minutes, you guys need to walk out of here with about 80% as much knowledge as we have about the shoulder. That might seem kind of unrealistic, but we're going to try as hard as we can to do that. Okay? So, when someone has shoulder pain, or any kind of pain really, the first thing you've got to figure out is what is the cause of the pain. Does anybody have shoulder pain here? Has anybody been told or found out what the cause is? Okay, what's the cause of your shoulder pain? Okay, so neck stuff. Okay. Anybody else been told what's wrong with their shoulder? Rotator cuff. Okay, so let's get right into this. Yep. Anybody know what the rotator cuff is? Yeah? All right, what's the rotator cuff? Okay, Dakota, what's the rotator cuff?
All right, so the rotator cuff are a few muscles that are in the shoulder. Okay, we obviously have them on both sides. And the rotator cuff, the job is to really support and stabilize our shoulder, more specifically when we're reaching up overhead. There's a lot of people that will say they can reach their arm out in front of them and they don't have pain, but it's once they kind of cross some sort of threshold, okay? They're reaching up overhead. Or the person like you guys that are exercising, they might say, yeah, I can reach my arm up overhead without any weight, no problem. But it's once I start to load that up, once I start to actually hold something that has maybe some moderate weight to it, they're going to have issues. And why? Is because the rotator cuff is basically stabilizing the joint. So the way that our shoulder joint looks, it actually looks like a golf ball sitting on a tee. So there's a lot more golf ball than there is tee. So we have the humerus, which is the long bone here, actually attaches to the shoulder blade. And basically when it's sitting there, if it's not supported or stabilized on that joint, the ball isn't sitting on the tee properly, then it can basically move around a little bit too much, okay? Again, that becomes less of an issue when our arm really isn't moving much. So that's below 90 degrees, below shoulder level. As soon as we start to reach up overhead, that's where we can start getting issues. So that's where someone says, yeah, I have pain, and their pain can be anywhere, but Travis and I really see very most common that people have pain in the front of the shoulder, okay? So I know that we had a few people here that said that they know they've been diagnosed with some type of rotator cuff injury. How were you diagnosed, if you don't mind me asking? MRI, okay. Does anybody know what the, like if everybody in here that had shoulder pain, that didn't know what the cause of their shoulder pain was, okay? So,
no idea. Okay, good.
So if we took this group right here, and we also took another group that said, yeah, I don't have any shoulder pain at all. What do you think the incidence of that other group that had MRIs without any shoulder pain, what do you think the percentage that we would see a rotator cuff tear in that other group that has absolutely zero shoulder pain? 0 to 100%.
What's that? 50. Yeah. So between 50 and 60.
Yep.
So you had an MRI, showed a rotator cuff tear. Is that what's causing the problem? For sure. Would you bet your life on it? No, not anymore. Right? Because you can walk around with a rotator cuff tear and not have any shoulder pain. So that's important to know. Like, diagnostic testing is important. It's really cool. It's great because the alternative is we just open you up and see what's going on in there. Sometimes we have to do that. But for the most part, you take a picture and it can give you an idea of what's going on in there. But it's not necessarily what's causing the problem. So we don't want you to get married to your diagnostic testing. That's what we say all the time. That's there, it's important, but it might not be what's causing the problem. Anybody ever heard of a labrum? Yeah? All right. You know what a labrum is? Something in your shoulder, right? Okay. So somebody told you have a torn labrum. Okay, so that's pretty common too. Dakota, what's the labrum?
All right, so we're gonna go back to that golf ball and that tee analogy. So we have the golf ball sitting on that tee. Well, has anybody ever seen a shower hook that you basically suction cup to the wall? Okay. Well, you can imagine that suction cup, if that's the labrum, if you put a little cut in that suction cup and try to stick it to the wall, it wouldn't work too well, would it? It's not going to do its job. So that's essentially what the labrum does. It holds that joint together. So again, it's another way that our shoulder gets stability. So very common that people will say, yeah, the shoulder doesn't feel weak, it just doesn't feel stable when they go to, again, reach up overhead. Maybe they're not having as much pain with it. They still could be having pain, but they might say, oh, it feels like something in my shoulder is catching. Okay. Typically, I don't hear that from someone that has like a rotator cuff irritation. They just say, it feels tight and I get some pinching maybe at the top, or it feels weaker. Someone might say, my shoulder, I feel it popping, clicking, or catching. All right. So that's really what the labrum does. It gives our shoulders stability. It's that suction cup that holds that joint together.
All right. So we know those two problems. Those are the main things that are going on in a shoulder issue. And most of those shoulder issues will say, people come and say, I have pain like right here, right in front. Anybody that's had shoulder pain, they have pain in the front, raise your hand. Raise your good hand. It's pretty common. Probably about 60 to 70% of people that have shoulder pain say, I got pain right here. The rest are kind of back here, and we'll talk about that now when we talk about nerve and tract. So we talked about someone that had neck problems, and now they have shoulder problems. So it's really important that if you've had a shoulder problem, you need to get your neck checked out. Because a lot of times, the neck can refer pain down to the shoulder. So I can have problems with my neck, and that can send pain down to the front of my shoulder. And then I can go get an MRI, and they can show a labrum tear or a rotator cuff tear and say, yep, that's what's it. And we've had patients that will go get, you got to get that labrum repaired. They'll go get the labrum repaired. We'll do all the surgery after, or we'll do all the rehab after surgery. The rehab goes great, but they'll say, Travis, I still have this pain, same exact pain I had. And it's because it was coming from here. So the nerves that run from your neck down through your shoulder, they supply sensation and motor function, which means when I touch you, you can feel it. And motor function is when I go to move my arm, it actually moves. If there's some kind of pressure on a nerve, nerves don't like any kind of pressure. And that can cause, typically it'll cause numbness, tingling, burning. You guys have probably maybe had some of that with some kind of neck issues. But it can just cause pain, or it can cause funny sensations like feels like there's hot or cold water running down my arms. If you have weird symptoms like that are not typical like generic orthopedic injury type situations, then you need to get the nerves checked. Anybody have any questions about that? It's usually never all one of those three things. I can't remember last time I saw just a rotator cuff or just a labrum tear. It's usually everything's kind of involved in some way, because as soon as you have a mechanical issue in any joint, your body tries to make adjustments around that. Typically that will irritate the nerves, irritate other soft tissue, so it becomes a problem, depending on how long it's been since the pain first started. What do you guys think is the average amount of time anybody with any body part problem, but with a shoulder, says they come in, they end up in our office, like, all right, when did this problem start? What do you think that is? What's that? It's pretty close. 9 months to a year is about right. So, because you can have shoulder problems, like you can use your shoulder, right? I mean, maybe not as much as you want to use it, or it still bothers you to think, but you got another shoulder. Like, that's what a lot of people do. They just start doing stuff with their other shoulder. Right? So you can get away with it for a long period of time. But the longer it goes, then the more adjustments that are made around it. It doesn't mean you can't fix it, it means it might take a little bit longer. Okay. All right, the next thing we're going to do is go over number 2. So first we got to find out what's causing it, right? Second, we got to find out what the top 3 are. Now we got to find what's causing it. So how do we find out what's causing it? So we talked about MRIs, right? So that's helpful, important information. But how we figure it out is with 2 things. We ask you your story, like what happened that started to cause your pain, okay? And then the other thing is orthopedic tests that we do. Anybody know what orthopedic tests are? So if you've been to an orthopedic surgeon or a physical therapist, they've probably done some tests. They put your arm in funny positions, and they'll ask you some questions and see what happens. So you don't know what's going on with your shoulder, right? What's your story? You want to come up and we can fix it? Okay, good. It's the only way I get people to talk. I say I'm going to fix it. Doesn't always happen.
I think my problem was these guys.
Okay.
I think I did a little too much.
We talked about not throwing these guys under the bus.
Well, we're still going to throw them under the bus.
Okay.
They did something.
Do you remember something specific that you did? Like one thing that you did?
It was some sort of shoulder exercise. I know after I did a shoulder exercise a long time ago here, ever since then my shoulder just...
Okay, like one specific time?
One specific time,
Okay,
yeah.
all right. So that's actually kind of rare. Most people that come in to us say, I don't know, I didn't do anything new. We'll always ask them, any change in activity, any increase in volume of activity. Sometimes they'll say, yeah, I did this shoulder
I
workout.
probably increased my weight at that point.
Okay.
They probably told me to.
Okay. All right. So sometimes that happens. A lot of times people kind of don't do anything about it because they're like, what am I supposed to say to the doctor? Like, I didn't fall off a chair, I didn't pick up anything. I don't know what caused the problem. So this is really common where it's like, you don't know what the cause is. You actually have some kind of relation to what it was. So you remember what specific movement you were doing?
My bet it was something with like an upward shoulder. Okay. Because it's like up here more like.
Okay. And where's the pain? The pain is
right around here.
Okay, up here. Okay, so there's a lot of things up here. There's your rotator cuff, your labrum, your AC joint, nerves that kind of go up down your shoulder. So we don't have a ton of information there. What are the questions you want to ask?
Did you hear any pop or crack, click, anything? Did you get that now at all?
No. And sometimes it's not as bad. Sometimes it's almost
when
like
it's
if
not
I
as
try
bad.
and overwork it, then it's definitely.
Okay, so when it's not as bad, you're just pretty much going a little bit lighter. You're still doing the movement,
Yes.
but you're just not going as heavy.
Yes.
Okay. Got it.
So now we're going to get into the orthopedic test stuff. So raise your arms up tight as you go. Okay, so pretty good range of motion, right? You guys are all junior PTs now. It's a little different on that side. You guys see that? A little bit, not much though. Some people come in and they're like, this, I can't lift your arm. Okay. All right, so you guys are going to do some special tests. So we're going to do, Dakota's going to do some special tests here. What's your name?
Michelle.
Michelle, perfect. All right. All right, if you have really bad shoulder pain, just be careful with these tests, okay? If you mess something up, I didn't do it. Okay? I'm going to show you a couple rotator cuff tests. That's the first thing we like to rule out because it is really common to have a rotator cuff now. So I want you to put your hand out like this, your bad shoulder. Okay? Now put your thumb down. Okay, if just doing this is painful, please don't do the next step. So, one, you got two bad shoulders? Oh my good. All right, you're going to have to help her out with her test. Okay, so thumb down like this, and then take your other hand and just push down on it. Like, hey, for anybody, when you push down on that, then increase the pain. A little bit. Not too bad. You got a rotator cuff tear. What the heck, man? This should be increase the pain. Anybody else have pain when they do that? You can't even do that? No pain. Okay. This is a Superspinatus test. Your supraspinatus is the top rotator cuff muscle. It's the most irritated one only because it's on top. It actually doesn't have a ton of function, but it is commonly torn. Okay? So if you're having pain with that, it's irritated. It doesn't mean it's torn. It could be partially torn. I don't know. We have to get an MRI or we have to do some other tests to find out. But again, I don't want you to think that's the most important thing that we have to find out. And we're going to find out how you move. If I told you you had a rotator cuff tear, but you had no pain in your shoulder, you could do everything you want. Would you care? No? Okay, good. Next test, like this. Again, if you have pain in this position, don't push too hard with this one. Okay? And then same thing. I'm going to push down here. Okay, when you push down here, anybody have pain in the front of their shoulder when they do that? No? Nothing? Nothing? Great. A little bit in the back?
Try to probably extend up.
Okay, so it's like it's weak. It feels like try the other side. Yep. Okay. This is a biceps tendon test. It's not really a rotator cuff tendon. We consider it a rotator cuff tendon, but books don't. Because it rolls back and it attaches into your labrum. So this is, if you have a biceps tendonitis, anybody ever hear that? It's common with throwing athletes, some have biceps tendonitis. That bicep attaches right into your labrum. So if you have an irritation there and if you have a torn labrum, and sometimes this test, it's even hard to get in this position or it's painful to do. Okay. So let's test out your labrum. This test is going to look really similar, but different positioning can change the stress on the tissue. So you're going to put your thumb down and kind of adduct your arm. So kind of bring it into midline. Okay, if this is really painful again, be careful with it. So from here, same thing, you're going to push down. Okay, so if you have pain with this, if you don't have pain with this, the test is over. Okay, pain with this, if you put your palm up, keep that arm over like this, and you push down, if that relieves the pain, there's a chance, well your labrum is definitely involved, but there's a chance it could be a tear in your labrum. So we're kind of ruling that out. And then the nerve tests are a little bit more complicated. I need a table, and I can show you that stuff to you guys if you come in. But those are some really basic orthopedic tests that we do. There's probably 50 orthopedic tests you can do for your arm. Those are kind of the most specific and sensitive, which means they're the most effective when you look at them. So it can give you some information. What did we find out?
So of all the tests that we did, the one that was most positive was the labrum test. So she had pain here. As soon as we flip the palm up, she's like, yeah, that takes that pain away.
Okay. Does that mean it's torn? Do we need surgery?
I would say so.
Yeah. So we've got to do a bunch of other things. But there's simple things that you can do to put stress on tissue to try to find out what is causing the problem. Once you know the problem, it's usually pretty easy to fix. That make sense? Anybody have any questions about those tests?
Butt over, straight, right?
All right. So the next thing we're going to do is I'm going to tell you something that can help you prevent shoulder pain or improve it, and it doesn't have anything to do with your shoulder directly. It has to do with your thoracic spine. So all you guys are sitting in a chair. You're going to go back because I want you to do this exercise. Guys, if you're really close to somebody, spread out just a little bit. And I'm going to grab this bench so I can show you what I want you to do. All right. Let me know where your thoracic spine is. Where is it? That's it. It's the middle. The neck at the top, cervical spine, back, low back. That's your lumbar spine. The stuff in the middle, the 12 segments in the middle is your thoracic spine. It's really important if you want proper shoulder function and you don't want to hurt your shoulder. Dakota, why is that the case?
Because, so this is a great test that you can do even on me. So if I stand here facing you guys, if I lift my arm up, I have full range of motion. As soon as I hunch over, okay, and flex my thoracic spine.
You guys do this, okay? So sit up nice and straight, good posture. Push your head up towards the ceiling. Lift your arm up. If you have pain with it, don't. Lift the other arm. And now just kind of look at where your arm goes to, okay? And now come back down, and then do this. Get in really crappy posture. Okay, bend forward, pretend like you're on your cell phone, right? And then lift your shoulder up. You don't do that,
and
okay?
even when you extend up, you should have a difference in the amount that you're able to lift your arm. As soon as you bring your chest up, not only, you might be only a few degrees off, but still that little bit makes a huge difference. Imagine you're trying to press through 10, 15, 20 degrees. That's really hard for you to do. You're going to overstrain, just like Travis said earlier. You're going to be able to start compensating, especially if you're trying to lift something moderate, heavy weight up overhead, okay? It's just not going to work, and that's where we get that pinching in the shoulder.
So if you don't have that thoracic extension, what's going to happen is when you go to lift your arm up, you're just going to jam everything in the front of your shoulder. Okay? But if I can open up my thoracic spine, I can allow for more shoulder clearance, and then I can do this. If I do this, and you're doing overhead stuff, you're eventually going to have a problem in the front of your shoulder. Okay? So we've got to improve your thoracic extension. Anybody know how to improve the thoracic extension? Okay. So we spend a lot of time in thoracic flexion, right? Sitting. Anybody sit for a living? Yeah, most people. Okay. So gravity's just pushing down on you all day. And what do? You just let gravity take over, and you're just you're hanging on your ligaments. So ligaments attach bone to bone. They go from each segment of your spine, and so you might start off the day in really good posture, and then eventually you're computer, you're moving around, and then you end up like this. Anybody ever feel like, oh man, like this is terrible? At least I can just kind of sit straight up. So if you do that for 8 hours a day, the chance of you coming into the gym and just automatically cleaning that up is low. Okay? You're probably at least going to be stuck here. And if you're stuck here and you're doing stuff overhead, you're going to have problems in the front of your shoulder. So you've got to work on it. You're sitting in poor posture for 8 hours a day. You don't have to be in really great posture for 8 hours to balance that out. But you have to spend some time in the opposite of that, thoracic extension. So this is thoracic flexion. This is thoracic extension. Okay? So I'm going to show you a really simple exercise that you can do. I would do this before I sit down for the day, just to kind of clean stuff out. I would definitely do it before I start doing anything overhead. If you see stuff on the board and it's like overhead stuff today, take a couple minutes to do this. But just sit in your chair, and from here, you can, if you cross your legs like this, then I'll take your hips out and we'll get more thoracic rotation. Just kind of do this as long as this is comfortable. And then put your hands on the back of your head. Hey, and all you're going to do is you're going to rotate to your right. So you're going to rotate to your right and look at your elbow and see how far it goes. So if you're looking towards the back there, oh yeah, it goes to the dumbbells or it goes to the medicine balls. See how far you can go to the right, because we're going to retest this in a second. Okay? And then come back to the middle so that you guys can see me. You're going to rotate to the right, and then you're going to side bend to the right. So side bending is just going to the side. So you're going to rotate, take a breath in, and as you breathe out, then you're going to side bend to the right. Okay? And then take a breath in again, and then rotate some more. So don't lose your rotation. Don't come back to me. Take a breath in, and then as you breathe out, you're going to side bend. So rotate a little bit more. So here, look at elbow, you're going to rotate like this. You're going to take a breath in, and then you're going to side bend to the right, and then take a breath in, and then you're going to side bend. And one more time, take a breath in, and then as you breathe out, you're going to reach up. Alright, now we're going to retest that. So physical therapy is all test, treatment, retest. So we tested your rotation, right? You look back and you said, all right, my elbow kind of goes back to the dumbbells. Do the same thing. So back here, and then rotate all the way to the right. See if it got any better. If it didn't get any better, I'm going to look really bad. Anybody see any improvement? So you took 2 seconds and you saw that much improvement. If you worked on that once a day, do you think eventually that would get a lot better? Okay? And of course, you're going to do the same thing to the other side. So that will improve your thoracic rotation. Again, your thoracic spine is back here. It's like, well, how much does that have to do with the pain that's going on in the front of my shoulder? More than you think. So working on that can be really effective. Another thing you can do is like a thread the needle. I like that one because most everybody works sitting during the day, so there's an opportunity for them to sit. Not everybody at work feels real comfortable getting down on the floor, but certainly here you can do it. From here in quadruped, all you're going to do is called thread the needle. So take your right hand and you're going to rotate over like that. So hopefully you guys can see, if my spine is a barrel, it's kind of rotating like that. Aside from like maybe looking over your left shoulder when you're trying to merge, I bet you guys don't spend a ton of time in thoracic rotation. So just spending a little bit of time there is going to be helpful. So that one is kind of the same thing, breathing. When you're trying to stretch, as you breathe in and out, has everybody ever been to yoga class? Okay, so have you ever been cued by the yoga instructor? Hey, as you breathe, now we can turn a little bit more. Okay, so think of that way. So you're just kind of breathing in, and then as you're breathing out, you should be able to rotate a little bit more. Never rotate into pain. If you're having pain, that's not okay. Some pressure, a little discomfort is okay, but in any sharp pain, we definitely want to try to avoid. Okay? Does that make sense? All right, so you've got 2 things there that you can work on to improve your thoracic spine mobility, and that's going to help out with your shoulder. If you have a really irritated shoulder, like a nerve impingement or a labrum or a really bad rotator cuff issue, is improving your thoracic rotation going to fix the problem? Maybe. It might take enough stress off of it, but depending on how long you've had it, I don't want you to think that's like, oh, if I go home and do that, it's going to fix all my shoulder problems. It might, but most likely not. All right. Anybody have any questions about anything we went over so far? No? Oh, here we go. Awesome. Great question. Bracing. So, should we use bracing in order to correct our posture? All right, Connie says no. Connie's been a patient of mine for a while, so she knows the spiel on this. The analogy I like to give is, everybody have glasses? Okay. All right, so when you went into your eye doctor, did they ever say, you know what, your vision's getting a lot better. Let's back this prescription down? No, why? Why not? Okay, there's people that are older than you that have perfect vision, okay? It's because the glass is doing the job that the muscles in your eye are supposed to do. So eventually, you're going to have a higher and higher prescription, right? We can agree there. So that's a form of bracing that people can kind of wrap their mind around. Another thing is like orthotics. Anybody wear orthotics in their shoes? Okay, yeah. So some people definitely need orthotics. I would argue that most don't. When you use an orthotic, it's doing the job that the muscles in your foot are supposed to do, right? So your foot says, great, I'm not going to do that anymore. And it gets weaker and weaker. And then what happens? They go back into the podiatrist, and it's like, hey man, we got to crank up this orthotic because your foot is falling even further because the muscles aren't doing anything. And then we got to get you in a motion control shoe. And then pretty soon you're walking around with bricks on your feet, right? Because you can't even tolerate getting out of there because the brace is doing all the job that the muscles should be doing. So, to go back to your question, it's a long-winded answer. To get you to cue that and get your body to kind of feel what that is, there's some biofeedback that happens there. It's not terrible. I don't want you to rely on that for long periods of time. So sometimes people with really bad posture, you guys ever see a collarbone brace? Anybody ever break your collarbone? Yeah? Did you have surgery? Okay, so brace will kind of pull that back. What we're trying to do is open up your shoulders because kids will typically sit like this, and then the collarbone, if it's fractured, it will just fall over, and then it will mend like that. You don't want that. You want it to be like this. So for a short period of time, we'll brace kids to set them back to make sure that it doesn't do this. Okay? So if your posture is really, really bad, I might consider that. But the first thing you're going to have to do is just, hey man, clean up your posture and give you like 2 or 3 things to work on, and then just kind of monitor your progress and see if we can do it that way. That was a good question. Any other questions? All right, so at the bottom of this page, we've got a couple things. One, you guys are going to get this ultimate guide, so you should have that. So it talks about, it would take me 3 hours to go through all this stuff in there, so this is more information for you guys. Second thing I want to show you guys is our free screen. So anybody that comes and listens to me and Dakota talk for a half hour and spends some time when they should be eating dinner with their family, we like to reward you with a free screen. So a free screen is a 30-minute appointment with one of us, and we don't charge you anything. We don't take your insurance. We kind of do a one-on-one workshop with you, where if you're having problems with your shoulder, we want you to try to figure that out. And sometimes free screen ends up in you coming in for physical therapy. Sometimes it ends up in like, I don't know, man, I want to see my ortho. I want to get somebody to check this out. Sometimes it's a different modality that we use. But the whole goal of it is to provide education. Because if you guys have shoulder pain, probably you guys went to Dr. Google, right? So anybody that has any pain, they'll go online and kind of search what's going on. There's lots of good information out there. There's lots of bad information. It's kind of hard for you guys to parse that out. Some people have had other treatments for the shoulder. Anybody had shoulder pain that had something different than physical therapy that treated it? Injections, went to a chiropractor, anything like that? Okay, all right, how'd it go?
I mean, good, but it's like you go and then like 3 days later I felt almost even worse than I did before. So, you know, I felt like now this is starting to like every week, staying at a level, so I just stopped going.
Yeah. So, by the way, I go to a chiropractor. This isn't like PT versus chiropractic. Really good chiropractors are awesome. But there's really good chiropractors, there's not so good chiropractors, there's really good PTs, not so good PTs. So a lot of people have had treatment before and they paid money for it and it didn't work. Did you get it for free or? Okay, no. All right. So I don't want you guys to have to forfeit any more money to find out if we actually know what's going on and can help you out. So that's why we do it for free. It's a 30-minute appointment with one of our PTs. If you came here and you have shoulder pain, at least take us up on that. I mean, it's a free appointment with a PT and we can show you exactly what's going on. So if you guys want to do that now, then you can sign up with Zoe. She can get you a free screen spot. We have offices in Bethlehem, Allentown, Upper Country, and Bangor. I don't think anybody's here from Bangor, right? That's a long way away. So, but we have offices there. Any of our PTs do the free screens. I also gave you guys a coupon for a massage. So we just started a massage program. I used to think massage was like, you know, I would go away on vacation and get a massage. That was pretty cool. But on patients where we're stuck, especially a lot of shoulder stuff, we give them to our massage therapist, and then they fix a lot of things that we can't fix. So we have a brand new massage therapist in Bethlehem, and her schedule is kind of light. So that's why those massages are so cheap. So if you guys want to take advantage of that, then we're just trying to find ways to help you guys out. If you're more comfortable doing that, I would say do the screen plus massage, and we can fix your problems. Anybody have any questions about anything? Dakota and I will stay out and hang out after if you guys have any questions about stuff. If you want to get a free screen, this is going to be our busy season, probably come up in like a month or so. So if you want to take care of a problem, if you have pain that's stopping you from doing things you want to do and you want to get rid of it, we're actually pretty good at that. So I would talk to Zoe. Sound good? Thanks, guys.